Yesterday morning, the Premier said that he would present Albertans with a, quote, careful and prudent plan to remove public health measures. What he came up with instead is a chaotic and dishonest mess. Hospitalizations are not declining. They are higher today than they have ever been. What's more, we have today new data from AHS, which shows that the number of people in hospital with COVID today is hundreds more than what was forecast for today in AHS's worst case scenario projected a mere week ago, back when the Premier was promising to lift restrictions at the end of March. The number of Albertans in the ICU today is also higher than last week's projected worst case scenario for this day. That's hard to hear, but it's also the truth, and Albertans have a right to a government that will tell them the truth. We are approaching the 2-year mark of this pandemic, and I know every single one of us really does want it to be over. I want it to be over. And to be clear, when we look at other jurisdictions who are just a bit ahead of us when it comes to reducing the pressure on their hospitals, I believe we're actually not far off. But you don't win a marathon by walking off the track 100 meters before the finish line. Now, I know that when we imagined the day public health measures could be removed, we expected it to be a day of celebration, a day when all of our shared sacrifice and hard work paid off. But today, Albertans are frustrated because of what they heard yesterday and because they know that what they heard yesterday was a lie. We would have a much more transparent relationship between our public health officials and the data on which they make their decisions and the recommendations that they make to government and the decisions that are subsequently taken by government. And so that whole dynamic would have been different all along. And so I like to think that, quite frankly, with that being the case, we wouldn't be in anywhere near the crisis position we're in right now with respect to our healthcare system. Because, of course, we also wouldn't have embarked upon a multi-level attack on our healthcare system, as we've seen this government do pretty much since when they were first elected. But certainly right now, if suddenly we, as of tomorrow, we're suddenly in charge, what we would be doing is we would be going to officials. We would be looking for a range of independent expert advice, and we would be looking at all the data, and we would be sharing that openly with Albertans. And that's what we've essentially been calling on this government to do for some time, to create an independent panel so that the quality of the decision making is increased accordingly. Going forward as well, what we would be doing is we would be continuing to talk about the value of vaccinations, not only in terms of keeping all people safe, but also in terms of those who are unvaccinated and the potential impact they risk having on our healthcare system right now should the rate of infection amongst those who are unvaccinated jump up in the face of restrictions lifting. And that seems to be a thing that nobody is talking about right now, which I think is troubling. And then, of course, I've always been someone who's talked about the rule of law. And when it comes to some of the protesters, we talked last week about seeking an injunction. And the fact that this government, acted after about 2 hours when there were protesters on the Walter Dale Bridge who were environmentalists about 2 years ago. But now we're on day 13 or 12 or 13 right now, with no action taken, shows to me a government that talks about the rule of law, but really it's just about the rule of politics.